But the question about should the note I write about a patient be viewable by that patient. There's a thing called open notes. So this movement that says, yes, patients ought to be able to look at what the information is in the notes. Some people, some physicians think, well, you know, I put some stuff in that note that's kind of wondering whether or not the patient is abusing this drug. And it's important to me to have that in there, so it raises my suspicion, so I keep looking for evidence of that, yes or no, when the patient comes back. I might not put that in the record if I thought the patient's going to look at it. I had a very obsessive compulsive patient one time who did a lot of really crazy stuff, like, you know, keeping his urine in bottles and stuff like that, and recording it all and things, etc. And I said in my note, you know, I recorded these things in my note, and he wanted to argue about every single one of them, because he got a copy of my notes by going to the records department and demanding them, and he would come back having edited them saying, no, this isn't obsessive compulsive behavior, you don't understand, I really do have to do this. And so I stopped putting anything in the notes. And that's the risk, that if people are reading your notes, will you redact information from them that might ultimately be important for care. There's a Open Notes consortium that was led by a senior faculty member at the Harvard Medical School named Tom Del Banco that has been looking at Open Notes and really has found that it hasn't really affected the content of the notes. And then after their study was done, almost all the patients and almost all of the healthcare providers, the physicians, wanted to continue doing it. The other thing is, well, then should patients be able to write to the notes? In other words, not just control who can see what in the record, but modifying the information in the record, disagreeing that, you know, the patient, they may disagree with something some impression that I had, and should they be able to record their own kind of counter impression? Should they be able to edit impression? If I might write something that's wrong, should they be able to say, no, this is wrong, I don't have this? We're taught as medical students to try to capture the patient's, why the patient is coming to your office that day in the patient's own words. So we're supposed to put quotes from the patient in there, like, I've been having this pain in the left side of my chest and it hurts when I take a deep breath. And we're supposed to put it in quotes like that. Well, why shouldn't the patient do that? I mean, who better to enter symptom information than the person who is actually experiencing the symptoms? Who should put in family history? How about the family? So if I'm caring for you and your brother, okay, I have to enter the same family history for both records because they don't look at each other. And yet there's no technological reason why they couldn't be the case. That it couldn't record the fact that you're brothers, so the same family history about your parents doesn't have to be repeated because we know that you shared the same parents, although not always. Brothers can have different mothers, different fathers. So it gets complex. But there is a movement now for allowing patients to actually not only share access to those, but sharing writing information to the record. And the whole notion is nothing about me without me. So if you're going to do things in your record that are about me and my care, then I ought to have some say and if I want to actively participate in that process. So maybe there's a way of tagging it so you know this is from the patient and not from the provider, so you can take it with a grain of salt if that's what you want to do. On the other hand, you know, currently I record the patient's symptoms, so I'm not recording the patient's symptoms, I'm recording my impression of what the patient told me. And I might not get it right. You know, we have biases too, and you can't live without them. And you know, in a busy day, I may forget what the patient told me, or I may get it wrong. So there's a lot to be discovered here that has a lot to do with the relationship between doctors and patients and their information. I don't know where it's going to end up, but there is some ongoing development in the notion of what's patients' role, and for kids, their parents' role in the documentation of their health and their healthcare experiences.